afternoon, everybody. I'm Dr. Suranjit Barua from Guwahati. So I'm here today to discuss about the relation with COVID-19 and diabetes mellitus. As you know, that COVID-19 infection has created havoc all over the world. It's a coronavirus group. It started in the Wuhan city of China in later part of the November or early part of the December. Then it has spread all over the world, affecting almost 200 countries and affecting more than 26 lakhs of people by now, and with a huge number of mortality, about 1,78,000 till today. So this is a big concern for the for the mankind, and it is a great challenge for the medical fraternity. Before going for the proper discussion with the diabetes, a little bit about the disease itself. As the virus needs human body to get it spread for transmission from one person to another person. It doesn't live long in the environment if it doesn't get access to the human body. And it is a heavier molecule, so virus comes from an infected person from its sneezing, coughing, and other body parts also where it is contaminated, and it can remain on the as a fomite in your tabletop or other things where an infected person touches. For there, it remains for 24 hours to 48 hours. It can spread as a droplet infection from 1 meter to 2 meter. And once it gets through to a human body, the incubation period is assumed to be about 14 days. Though nowadays, as the number of patients are increasing and we are more experienced, nowadays it has been said that it may extend up to 28 days also. So this is minimal about the virus, how it gets spread. Thing is this, that always prevention is better than cure. So all universal precautions you have to take so that you do not get infected. What are those precautions? Frequent hand washing with alcoholic disinfectant, so that if you get contact also with the virus, it will die. With soap or other alcoholic disinfectant, whatever is anything you can use, whatever available. Secondly, use a face mask all the time so that it doesn't get transmitted from you to other people, or you can get infected from other patients also. Thirdly, as a droplet infection, it can spread up to 1 meter to 2 meter. So maintain social distancing so that it doesn't spread from one person to another person. When you go out due to some activity or some causes, you go out, you may meet there is risks that you may get infected or contaminate the virus. So while coming back home, you change your clothes, shoes, socks, everything, and take a bath. So these are the precautions what you have to take. Not being as a diabetic patient, but it's for all. For everyone, it has to be maintained. So as the statistical analysis has said that once you get infected, majority of the patient need not have to get hospitalized also. It is just like, and majority of the patients are asymptomatic also. Only 20 to 30% patients become symptomatic. Out of those symptomatic, 10% needs ICU cares, and out of this, 4 to 6% patient dies. So it spreads like very fast. It spread like, uh, but the mortality rate is not that high in comparison to other SARS like Ebola and other viral pandemics in the past. But is the transmission rate is very high, so it spreads like very fast to one person to another person, and that's why within this 4 5 months it has covered almost 200 countries in the world. So whom does it get infect or affects most? It can affect all age group people, but diabetes patients, patient with kidney disorders, patient with some any form of cancers or any form of chronic lung disease, or elderly group of patients of more than 65 years of age, or chronic smokers, all those people are at high risk of getting infected or getting the disease symptomatic. And once as this group of patients has got poor immunity, immune system is a bit poorer in comparison to the other normal people, the disease once affects this may be in a may develop to a very serious form. So this group of people have to be more cautious. They have to take preventive measures. They have to abide by the norms and rules formed by the government authorities or different health authorities, so that they do not get infected. But as you are having diabetes, you need not have to be terrified for this, because if you take proper measures, you may not have that, you may get rid of this disease also. So one major thing is that you have to keep your diabetes under control, keep your sugar under control. You target, you have to reach, you maintain the fasting below 110, pp blood sugar below 140, uh, so that, and do frequent testing so that you know the status of your blood sugar at present, what status you are maintaining, so that you can, if it is not controlled, you can take measures immediately to make it, bring it to the normal range. So it will reduce your chance of infection. So frequent self-monitoring of blood sugar is essential. You regularly get it checked, all diabetes patient, and take measures if it is not if it is out of control. Secondly, now all people are inside at home mainly, and so while you are at home, you are spending a leisure life. So that can increase your blood sugar also, your body weight also, if you do not take care of this. So during this period, uh, you maintain regular exercise. It is difficult to go for gym. It is difficult to go for morning or evening walk every day because of the lock. But you can maintain at least 30 minutes exercise, free hand exercise inside your house, or walking, brisk walking for 30 minutes inside your house or inside your campus, so that your body activities is maintained, which will help you in keeping your blood sugar under control, your body weight under control. In while in the maintaining your while staying in the house, you used to take lots of snacks or uh, other small things which are high calorie or fried foods. Just talking with your other family members or gossiping with the other family members, you keep may keep taking. That will increase your calorie very much. So you have to take precautions so that you avoid this. You avoid this because you cannot go with your other family members which are non-diabetic or who are maintaining good health. So you have to avoid those snacks in between your principal meals. You take healthy food, you take fruits, apple, guava, mosambi, like this, what has been allowed in the diabetes with low glycemic status. You take regularly, do exercise, and do not get panicked because of your coronavirus or COVID-19, only because you are diabetic. If you are disturbed mentally to little bit with the situation, you take some other measures like meditation, yoga to keep your mental status cool. But as such, there is nothing to worry if you maintain everything normally. If you maintain everything as per the government or health directions. So these things you have to make to get rid of severe COVID-19 infection. Thirdly, it is not like that everyone may get rid of the infection. Somebody may get infected by some means. Diabetic patient also. So if somebody got exposed or come to contact with this positive COVID positive patient or COVID positive contact people, then you report to the health authority immediately. Get yourself tested. And as I said before, majority of the cases are COVID positive people are asymptomatic. Most of them doesn't require any hospitalization, but you have to quarantine yourself so that you do not infect others. You do not infect your friends and other family members. So, so be alert that you do not get exposed or do not come to contact with any positive patient or positive patient's contact persons. And if you come to contact, then you report immediately, get yourself tested. If positive, then go for quarantine. If negative also, you stay for quarantine for a period of 14 days so that you can save other people, your close or near and dear ones from getting infected. Then nowadays, many people in many social medias, you will get that you take this medicine, you will get rid of, it will prevent from COVID-19, or there is this medicine is helpful, those medicine helpful. Do not take any medicine for COVID-19 over the counter without consultation of your physician. Rather than helping it, it may give rise to some deleterious effect in your case also. So do not take any medicine for COVID-19 over the counter. So in nutshell, I will just repeat the things that you, being a diabetic patient, you should know that you are at the high risk zone. The disease may be in, may go in very severe form. Your sugar, blood sugar is not under control. If therefore you have to take the all universal precautions or uh, like uh, and especially precautions for the COVID-19, like wearing masks while you go out of the house, frequent hand washing, wash your clothes and shoes while coming, and take a bath while coming home from outside, maintain social distancing. Then if you maintain your normal medicines for diabetes and other conditions, comorbid conditions also, whatever you are taking, you continue regularly. Frequent regular checkup of your blood sugar level by glucometer at home so that you know your status every day. If not control, you consult your doctor and bring down the blood sugar level within normal limit. That is most essential. Then go on physical exercise, whatever is feasible for you, at home only or inside your campus, maintaining social distance. Take healthy food. Do not take snacks in between as you are sitting idly without eating. Do meditation, yoga if you are disturbed mentally, or if you're not disturbed also mentally, it will help you to bring the peace of mind. And do not take any over-the-counter medicines for COVID-19. Then lastly, if somehow some of you get exposed to COVID-19 patients or any contact person who has who was exposed to COVID-19 patients, you inform the health authority immediately, quarantine yourself immediately, get yourself tested, then go as per the advice of the health authority or doctor who was looking after the COVID infections. If by chance you get infected, you have to modify your treatment of diabetes. Ideal and while you got infection, ideally you stop all your oral medications. Better to switch over to insulin if possible. If not possible, also you few groups of oral medication you have to avoid, mainly SGLT2 inhibitor groups at the most. Other things under supervision you can continue, but it is better to switch over to insulin temporarily till you are cleared of the COVID-19. Because it helps you, it gives you easiest measures to can keep your blood sugar under control while you got infected by the help of insulins. So this is my advices from you for you people. I hope you can, if you maintain this, then you would be able to be outside the COVID zone. Outside the, you may prevent yourself from getting infected. And if by chance, unluckily, you get infected also, you would be able to come out without any serious problem if you maintain your blood sugar and report to the health authority at the earliest. Thanking you all.